Everyone wants to know how to prevent dental disease, dental cost, sitting in the chair, getting injections. Nobody likes that, okay? So everyone wants to know what they can eat or what they can avoid eating, or what tool will work, and how do they keep it clean, and how do they avoid decay. And it's really simple. The bacteria that cause decay eat sugar and poop acid, okay? So it's acid poop that causes decay. Now, the frequency, if you took a bowl of sugar and ate it all at one sitting, you'd have some real diabetic problems, but you'd only get 20 minutes of decay. You took a teaspoon of sugar and divided it into 10 parts and took one part every 20 minutes, you'd get 10 times the decay, the disease-producing problems from bacteria as you got from the entire bowl of sugar. So the worst thing that you can do is sip on sugar all day long or bite sugar. And by sugar, I'm talking about carbohydrate. But alcohol is just refined sugar. And pastries break down in the mouth with saliva into sugar. And so there's all kinds of things that you can get sugar from that you don't think are sugar. Crackers, I see mothers giving babies crackers all the time. Well, they're going to have decay before they're 5 years old. And if you give a child, and we're all children, no matter how old we are, if you give a child broccoli and then you give them ice cream, they will never eat broccoli again. They will cry until you submit and give them what they want. And that's juice, and that's crackers, and that's treats, and that's power bars, and that's all the stuff that the bacteria, the acid-producing bacteria, need to destroy the tooth. Acid erode it. And we talked about the holes in the cracks. So these bugs get inside, and they don't destroy the tooth from the outside generally. They destroy the tooth from the inside. And the outside of the tooth is like a granite castle. But the holes in the cracks, the pits and the fissures, those are like the doors and the windows. But they never put them in. So these are wide open holes that go into the teeth. And I've talked in previous things about these bacteria being transmitted from the parents. Well, they're inside the tooth in literally minutes of the tooth coming in to the mouth. And those bacteria can stay in that tooth, in the inside of that tooth, for 80 years. And every time you take your toothbrush out, they come back out and repopulate. And so that's why brushing that pencil line, that shoreline, that junction of the tissue to the tooth, that seal, it's a gasket, it's a seal, but it's the tooth above the seal that you need to get clean on a daily basis. And so back to bacteria and decay, it's bacteria producing sugar. It's the frequency with which you get sugar. If you only had juice once a day, juice isn't bad. But if you have a sippy cup with juice in it all day long, you're going to have baby bottle caries and be absolutely destroyed by the amount of damage it can do to a child. Thank you very much.